Question 31. What is the best technique for the LPN to use when determining the client's respiratory rate? A. Tell the client you need to count their respiratory rate. B. Ask the client to sit still for 30 seconds. C. Subtly watch the client from across the room when they are doing an activity. D. Count respirations while pretending to check the client's pulse. Correct answer. D. Count respirations while pretending to check the client's pulse. The best technique is to count respirations while pretending to check the client's pulse. This approach ensures that the client remains unaware of the respiratory rate assessment. If a client knows their breathing is being observed, they might alter their natural breathing pattern, which could lead to inaccurate readings. By pretending to check the pulse, the LPN can discreetly monitor the client's breathing rate, ensuring a more accurate and reliable measurement of the client's normal, relaxed respiratory rate. This method helps the nurse gather more precise data without influencing the client's natural respiratory rhythm. Question 32. At approximately what age do children begin to develop stranger anxiety? A. 3 months. B. 6 months. C. 9 months. D. 12 months. Correct answer. B. 6 months. At this stage, infants begin to recognize familiar faces and may become anxious or distressed when encountering unfamiliar people. This developmental milestone reflects the infant's growing awareness of their environment and attachment to primary caregivers. Stranger anxiety often intensifies around 8 to 9 months and may persist into the toddler years, but it is a normal part of cognitive and emotional development. Question 33. The PN receives a call from a mother caring for her infant. The PN should inform the mother that which of the following medications should be used with extreme caution. A. Acetaminophen. B. Bacitracin. C. Diphenhydramine. D. Simethicone. Correct answer. C. Diphenhydramine. Diphenhydramine is an antihistamine commonly used to treat allergies and insomnia, but it can cause significant sedation, drowsiness, and potentially respiratory depression in infants. Its use should be carefully monitored, and it is typically not recommended for young children unless prescribed by a healthcare provider. Question 34. Which of the following is the best example of an ethical principle in nursing when caring for a cardiac patient? A. The nurse did not cause harm to the patient. B. The nurse maintained honesty with the patient during any education and care. C. The nurse promoted the patient to be respected and involved in their care. D. The nurse followed through with any promises made to the patient during their care. Correct answer. B. The nurse maintained honesty with the patient during any education and care. Honesty is a fundamental ethical principle in nursing. It encompasses transparent communication, providing accurate information, building trust with patients, respecting patient autonomy. Question 35. Which of the following patients should the nurse see first on the maternity unit? A. A patient independent of contractions. B. A patient who is 2 weeks preterm. C. A patient who is entering the transitional phase of labor and requests to use the bathroom. D. A multigravida at 35 weeks gestation, whose fetal heartbeat is 160 with variation of plus or minus 5 beats. Correct answer. B. A patient who is 2 weeks preterm. Preterm labor carries risks for both the mother and the baby, such as respiratory distress syndrome or developmental concerns. The nurse must prioritize this patient to assess whether the labor is progressing prematurely and intervene if needed to prevent complications. Question 36. The nurse is providing education to an elderly client. Which of the following approaches would be least appropriate? A. The nurse allows additional time after each instruction to allow the client to process. B. The nurse breaks up the education into multiple shorter sessions. C. The nurse provides supplemental written resources. D. The nurse breaks up the education into multiple shorter sessions. Correct answer. D. The nurse breaks up the education into multiple shorter sessions. Speaking in a loud voice is unnecessary and can be perceived as disrespectful or condescending, especially if the client does not have significant hearing impairment. It may also create discomfort or anxiety. Instead, the nurse should speak clearly and at a moderate pace, ensuring that the client can hear and understand the information being provided. If hearing loss is a concern, it is more effective to speak clearly, face the client, and adjust the environment, such as reducing background noise, rather than simply increasing volume. Question 37. Which of the following is least likely to be a barrier to learning? A. A client who states they are not interested. B. A client with dysphagia. C. A client who took Ambien an hour ago. D. A bipolar client currently in a manic phase. Correct answer. B. A client with dysphagia. A client with dysphagia would likely not face significant barriers to learning, as dysphagia refers to difficulty swallowing, which generally does not affect cognitive function or the ability to process and retain information. Barriers to learning are typically related to factors such as cognitive impairments, emotional distress, language barriers, sensory deficits, e.g., vision or hearing loss, or physical limitations that directly impact a client's ability to engage in the learning process. While dysphagia may impact nutrition and require specific dietary education, it does not inherently impair the ability to understand or retain information, making it unlikely to pose a barrier to learning. Question 38. A 5-month-old boy is brought to the doctor's office by his mother for a well-child visit. Of the following, which one would reflect a developmental delay if observed by the nurse? A. The child's weight has increased, from birth, by about 7 pounds. B. The child, when lifted by the arms, displays head lag. C. The child babbles, but cannot speak any real words yet. D. The child is able to sit with support on the examination table. Correct answer. B. The child, when lifted by the arms, displays head lag. Head control is typically developed by 4 months of age. By 5 months, a baby should no longer exhibit head lag when pulled to a sitting position. The presence of head lag at this age could indicate a delay in motor development and suggest potential issues with muscle strength or neurological function. Therefore, this observation would be a red flag for a developmental delay. Question 39. Which of the following materials would the graduate nurse request to test the function of a patient's glossopharyngeal nerve? A. A stethoscope. B. A handheld mirror. C. Soft cotton swab and a toothpick. D. Tongue depressor. Correct answer. D. Tongue depressor. The glossopharyngeal nerve, cranial nerve 9, plays a role in the gag reflex, swallowing, and taste. A tongue depressor is commonly used to test the gag reflex by gently stimulating the back of the throat, which helps assess the function of the glossopharyngeal nerve. This tool allows the nurse to evaluate the nerve's ability to trigger a normal gag response, which is an important indicator of proper function for swallowing and throat sensation. Question 40. The nurse works in an outpatient sexual health clinic. A patient asks the nurse about the most effective method to prevent pregnancy. What should the nurse's answer be? A. Coitus interruptus. B. Condoms. C. Abstinence. D. Religion. Correct answer. C. Abstinence. The reason for this answer is that abstinence, or refraining from sexual activity, is the only method that is 100% effective in preventing pregnancy. Unlike other contraceptive methods, abstinence eliminates the risk of pregnancy entirely, as there is no possibility of sperm fertilizing an egg. This makes it the absolute method of pregnancy prevention, as the patient asked. Question 41. The patient visiting the clinic seeks information on preventing both pregnancy and sexually transmitted infections. What strategy does the nurse recommend in response? A. Birth control pills. B. Coitus interruptus. C. Latex condoms with spermicide. D. Copper intrauterine device. Correct answer. C. Latex condoms with spermicide. Latex condoms with spermicide provide dual protection by helping to prevent both pregnancy and sexually transmitted infections. Latex condoms act as a physical barrier to block sperm and prevent the transmission of infections during sexual activity. When combined with spermicide, which immobilizes or kills sperm, this method increases the effectiveness of pregnancy prevention. Condoms are one of the few contraceptive methods that offer protection against both pregnancy and STIs, making them an appropriate recommendation in this context. Question 42. During disease prevention education, the nurse advises a 63-year-old woman with no family history of breast cancer to schedule mammograms at what interval? A. Once a year. B. Every 5 years. C. Every 10 years. D. Every other year. Correct answer. D. Every other year. According to guidelines from organizations like the U.S. Preventive Services Task Force, women aged 50 to 74 with average risk for breast cancer, which includes those without a family history, are advised to have a mammogram every other year. Regular screening at this interval helps in early detection of breast cancer while balancing the risks of overscreening, such as false positives and unnecessary interventions. Thus, a mammogram every 2 years is the recommended interval for this 63-year-old woman. Question 43. Which client on the home health nurse's daily schedule is at the highest risk for abuse? A. A 88-year-old male with newly diagnosed bilateral cataracts. B. An 84-year-old woman with advanced diabetes complications. C. A 74-year-old man with poorly controlled hypertension. D. A 76-year-old woman recovering from a broken hip. Correct answer. B. An 84-year-old woman with advanced diabetes complications. An 84-year-old woman with advanced diabetes complications is at increased risk for abuse due to several factors commonly associated with elder abuse. Older adults, particularly those with chronic health conditions or disabilities, such as advanced diabetes, may become physically frail, making them more dependent on caregivers for daily needs. This dependence can increase vulnerability to abuse or neglect. Additionally, elderly individuals with complex medical conditions may experience cognitive decline, social isolation, and financial strain, which are all risk factors that contribute to the likelihood of abuse. Therefore, this client is most at risk. Question 44. Which of the following actions should the nurse take to assist a nursing assistant who was injured in a fire and now walks with a prominent limp and unsteady gait in returning to work on a critical care unit? A. Offer the nursing assistant a secretarial position on the nursing unit. B. Transfer the nursing assistant to a surgical unit. C. Survey other units for positions more suitable for the nursing assistant's abilities. D. Recommend the assistant take a leave of absence without pay until her rehab is more complete. Correct answer. C. Survey other units for positions more suitable for the nursing assistant's abilities. The nursing assistant's physical impairment may prevent her from working in a high-demand critical care unit. The best approach is to find a role within the hospital that matches her current abilities, allowing her to continue her recovery while still contributing her skills. Surveying other units for suitable positions is the most supportive solution. Question 45. Which of the following is not a risk factor for glaucoma in a 78-year-old woman who has been diagnosed with the condition? A. Age. B. 20/80 vision. C. Mexican-American heritage. D. Blood pressure reading of 143/89. Correct answer. C. Mexican-American heritage. Glaucoma is primarily associated with factors such as age, family history, elevated intraocular pressure, ethnicity, and certain medical conditions like diabetes or hypertension. While 20/80 vision indicates reduced visual acuity, it is a symptom of existing vision impairment rather than a contributing risk factor for developing glaucoma. Glaucoma is related to damage to the optic nerve, often due to increased intraocular pressure, not directly to the specific level of visual acuity, like 20/80 vision. Question 46. What is the appropriate treatment for a pregnant patient with subclinical hypothyroidism? A. Levothyroxine. B. Thyroidectomy. C. No treatment. D. Radioactive iodine. Correct answer. C. No treatment. Subclinical hypothyroidism in pregnancy typically presents with mildly elevated TSH levels and normal free T4 levels, and many cases do not require treatment. In pregnant patients, mild or subclinical hypothyroidism may not lead to adverse outcomes, and routine treatment is not always necessary unless TSH levels are significantly elevated. However, the decision to treat depends on factors such as the degree of TSH elevation, the presence of thyroid antibodies, and the patient's overall health. If TSH levels are borderline and no symptoms are present, no treatment is often appropriate, but monitoring throughout pregnancy is essential to ensure that the condition does not progress. Question 47. During an educational session, the nurse is informing prospective parents about Down syndrome. The nurse asks which of the following characteristics presents the highest risk for Down syndrome. A. Advanced paternal age. B. Advanced maternal age. C. History of repeated radiation exposure. D. History of chronic alcohol and tobacco use. Correct answer. B. Advanced maternal age. Advanced maternal age is associated with the greatest risk for Down syndrome because the likelihood of chromosomal abnormalities, such as trisomy 21, which causes Down syndrome, increases as a woman ages. Women over the age of 35 are at significantly higher risk due to the aging of their eggs, which can lead to errors during cell division. This makes maternal age a key risk factor for Down syndrome in newborns. Question 48. What initial action does the nurse take when a 4-hour-old neonate is transferred from the mother's room to the special care nursery with a temperature of 35.4 degrees Celsius? A. Assess the child's blood pressure. B. Encourage the mother to swaddle the baby in a sleep sack. C. Report the finding to the provider. D. Check a point-of-care glucose level. Correct answer. D. Check a point-of-care glucose level. The nurse's initial action of checking a point-of-care glucose level is appropriate because a neonate with a low temperature, 35.4 degrees Celsius, is at risk for hypoglycemia. Hypothermia in newborns can lead to increased glucose consumption as they try to generate heat, potentially resulting in low blood sugar levels. Checking the glucose level ensures early detection and intervention to prevent complications associated with neonatal hypoglycemia, such as lethargy or seizures. Question 49. Which patient in the group being evaluated is most likely to develop thyroid disease? A. 36-year-old woman pregnant with twins. B. 38-year-old man with a history of testicular cancer. C. 42-year-old man with type 2 diabetes mellitus. D. 55-year-old morbidly obese woman. Correct answer. A. 36-year-old woman pregnant with twins. A 36-year-old woman pregnant with twins has the highest likelihood of developing thyroid disease due to several factors. Pregnancy can lead to increased demands on the thyroid gland, especially in cases of multiple gestations, where the body requires more thyroid hormone to support the growing fetuses. Additionally, women in this age group are at a higher risk for thyroid disorders, such as hypothyroidism or gestational hyperthyroidism. The combination of advanced maternal age and the physiological changes associated with pregnancy contributes to her increased risk for thyroid disease. Question 50. At the 28-week appointment, which prenatal test is administered by the nurse to the pregnant patient? A. Screen. B. Chorionic villus sampling. C. Maternal serum alpha-fetoprotein test. D. Glucose tolerance test. Correct answer. D. Glucose tolerance test. The nurse administers the glucose tolerance test during the 28-week appointment because this test is used to screen for gestational diabetes. At this stage of pregnancy, it is standard practice to check the mother's blood glucose levels, as gestational diabetes can develop in the second or third trimester. Early detection is important to manage the condition and reduce risks for both the mother and the baby.